All right, so let's talk about some of the eating disorders that we're going to see pop up. This is going to include anorexia nervosa, bulimia nervosa, binge eating, and then a few uncategorized eating disorders. So anorexia nervosa. So anorexia, when we talk about it as a medical condition, is the inability to eat as like a side effect of medication or a disease process. Anorexia nervosa is the inability or unwillingness to eat as an eating disorder or mental health condition. This is going to be categorized by restricting caloric or energy intake to below the daily requirements, which is going to result in significant weight loss and malnourishment. That's a key point. These clients with anorexia are going to be underweight and malnourished. They're going to be skin and bones. There's going to be a disturbance in self, and their self-evaluation or self-worth is going to be linked to their body image, body weight, and their shape. Typically, we're going to have an onset of a stressful life event, and we may be preoccupied with food and rituals of eating, along with a voluntary refusal to eat. Okay, we can have restricting type or binge eating purging type. So, restricting type is during the last 3 months, the individual has restricted their intake and has not engaged in binge or purging activity. Whereas the binge eating purging type, we have had episodes of binging and purging, which is overeating a little bit and throwing up, making yourself regurgitate. A lot of times anorexia has comorbidities like bipolar, anxiety, depression, OCD, PTSD, and alcohol and substance use disorders. Eating disorders are one of the most deadly psychiatric disorders. They do have a 10% mortality rate because of the malnourishment, the electrolyte imbalances, and everything else. So for our general assessment, a big thing we want to assess is the patient's perception of the problem. We want to assess their eating habits and their nutritional intake and fluid intake. We want to discuss their history of dieting or purging, methods of weight loss, and their daily activities. A lot of times our clients with eating disorders will over-exercise to help lower or maintain a low weight. So we need to be mindful of that as well. We need to look at the values that the client has attached to their body and their shape and their weight. We want to look at their interpersonal and social functioning along with their support groups, or their support systems. We want to look at mental status, and we want to screen for suicide and self-harming behavior. That's huge. Another big one is that review of symptoms and vital signs and laboratory testing. Okay. And that's big because of refeeding syndrome, which I'm going to talk about in a second. So some clinical manifestations of anorexia nervosa, they're going to be thin and emaciated. We're going to have that low blood pressure, low heart rate, dysrhythmias, hypothermia, dehydration, fluid and electrolyte disorders such as sodium, potassium, and chloride, magnesium, and calcium. They're going to have anemia. They can have neutropenia and hypoglycemia. They may have that peripheral edema, so that swelling of the limbs. Might have that mottled or orange or yellowish skin. Dry, brittle nails. lanugo, which is that fine, downy hair that can grow on the face, back, and arms. This is a body's response to being so cold and malnourished that it does this to try to keep the body warm. We may have decayed or missing teeth from the lack of nutrients, muscle weakness, decreased bone density, easy bone breaks, GI problems, decreased urinary output, and menstrual irregularities, such as amenorrhea, so the menstrual cycle can cease because of the lack of body weight. So refeeding syndrome is when nutrients are restored. Insulin stimulates glycogen, fat and protein synthesis are happening in the body. So when we start getting an anorexic patient to start re-eating or refeeding, this is lethal condition that results in a strict fluid imbalance and electrolyte imbalance. And basically the body cannot process everything that's being put into it because it hasn't fed in so long. So your electrolytes go out of whack, you're at risk for potassium disorders, you are at risk for, so that puts you at risk for dysrhythmias. You can also have symptoms of like fluid volume overload because of the pressure and work that refeeding puts on the heart and the lungs. So we got to be really mindful of that. When we are treating anorexia, we can use pharmacotherapy, so we can use pharmacological treatments, but there is nothing that's been proven to help with anorexia in itself, but we do treat the co-occurring disorders. So if they have depression with their anorexia or anxiety or OCD, we're going to treat those things, which can in turn help decrease the symptoms of anorexia. We're going to use integrative medicine like light therapy, massage, acupuncture, as well as insight-oriented individual therapy, family therapy, behavioral therapy, CBT, cognitive behavioral therapy. So biggest things with anorexia nervosa, they're underweight, they're skinny, they have that preoccupation with food, they can have ascites and menses, and we're worried about refeeding syndrome. All right. So similar to anorexia is bulimia nervosa. Bulimia, just like with anorexia, we are going to have a distorted body image and a fear of weight gain. However, these clients are going to be at or over their ideal body weight because of the binging and purging. They're not restricting it enough to be malnourished. So during this time, there is binging, which is excessive amounts of food that is consumed uncontrollably in a short amount of time, and the person feels emotionally out of control. That is a binge. This is followed by purging, which is inappropriate compensatory behaviors. This can include this to prevent weight gain from the binging, which can include self-induced vomiting and misuse of medications such as laxatives and diuretics. The key point with these guys is they are going to maintain a normal weight. All right.